All right. Wow, great turnout, great turnout. We're going to go ahead and get started in the interest of everybody's time. But hello and welcome to the very first DuPage ROSC Council meeting of 2023. I'm very, very happy to see everybody back safe and sound and excited to be back up and running. I would like to start by asking everybody, if you're not speaking, to please mute your microphone when you're not using them so we can keep down any possible disruptions to a minimum. I appreciate that. Also a reminder that we are recording these meetings. We put them up on our YouTube page, which I'll show off here shortly. So if anybody ever misses them, you can find them on YouTube. Some more housekeeping. It would be great if everybody could put their name, organization, if applicable, and contact info in that chat. Connecting with each other around here is like one of the biggest parts of what the ROSC is about. So staying updated is real easy by sharing those contacts with each other. A little later, in a few minutes, we will be discussing one of the ways that we'll be keeping in touch specifically for referrals and other help in 2023. So stay tuned for that. I would like to mention too, before we start, and this is just a personal aside, if you're not already, please make sure that you and the people you love are carrying Narcan with you at all times. We're aware of just kind of a rash of overdoses in our area, seemingly more than usual lately. If you are ever in need of Narcan for personal use or to distribute, you can always attend one of our meetings here in person, which is the second Wednesday of every month at Serenity House. Or if you're in DuPage County, you can go to the Kurzweil building at the DuPage Health Department in Wheaton. They have an amazing Narcan vending machine there, the first one in DuPage County, that they should be very proud of for getting that in. Or you can always contact Scott Kaufman, who's here, who works with the DuPage Narcan Project and Behavioral Health at DuPage Health Department, who's been awesome in making sure that we always have Narcan and it's around and available for whoever needs it. I'll get that personal side out of the way. Everybody carry Narcan. I did also want to thank everybody who attended the DuPage ROSC holiday party in December. I was not one of those people. I was at home with COVID and kind of beamed in as a giant talking head on a screen. But we have such an amazing team here that made sure that everything was running smoothly. So thank you to everyone who showed up. And also, we are incredibly appreciative of everyone who donated a winter coat for our coat drive. So we were actually able to donate 10 plus big bags of winter coats to the People's Resource Center in Wheaton, which is such a beautiful, amazing thing. And everybody really came through on that drive, especially for the first one. This was the first type of clothing drive we've done. So thank you to everybody who donated. And in fact, we are already starting our next clothing drive. We're going to be doing a drive every couple of months. It's not always going to stay clothing. Sometimes it might be toiletries or food or whatever the needs are of our partners. But I'm going to get to that next drive here in a little bit. So I'm going to share the screen here. We're going to go over a few things. Oh, hang on one second. Try this again. Okay, there we go. Sorry, everybody. Thanks for being patient. All right, so I just wanted to go over the agenda for today's meeting real quick. So we are right here in the opening comments. After this, I'm going to go over some of the upcoming meetings, some of the presentations, and some of the projects that are going on with DuPage ROSC and in the area. My co-coordinator, Danny, is going to talk after that about how to join the, for lack of a better term, we call it the ROSC referral team. I want to get something snappier like ROSC Action Squad or something, but this is that referral team that we've been using up till now, but this is going to change a little bit in 2023. So he's going to kind of jump on and explain that. After that, we've got Bryan Gooding, who is going to tell us about the amazing helpline for opioids and other substances. If you have not had a chance to use this yet, this service is a lifesaver, literally. And we at the ROSC, when we're handling referrals, not only that, but at Serenity House, when we're trying to find services for folks, we use this all the time. They've really been able to streamline what was before kind of a cumbersome process and really made it a lot easier to find services for people. So looking forward to talking to Bryan. And then as we kind of get towards the end, we'll obviously leave time for organizational updates. We want to find out about what projects and programs you're working on, if there's anything that we can help with. where are gaps in services? Where do you need support? If there's recovery program meetings you'd like to promote, that's where we spend that time. And then we'll, at the closing, kind of go over what's coming up for next month. So I'm going to stop this share for just a second here. So I thought it'd be important. I did this at the last meeting when I wasn't here and I was just on my giant head on a screen. And especially since it's starting as a new year, to kind of maybe explain a little bit about what it is that ROSC does. So if anybody here is new, I kind of just want to go over a little bit as a primer for what it is we do and what it is that we're trying to work on up here. So I'm going to share this. And the other reason I want to do that is because we have also started, and it's in its very infancy right now, an RCO, which is a recovery community organization. We are called DuPage ROSC, and this one is called DuPage RCO. So we know there's going to be some confusion possibly in the next few months as we get everything up and going, but I do want to take some time to explain what it is this does and what are some of the things that maybe were happening under the ROSC banner before that might be kind of migrating over to this RCO. So for those of you who don't know, ROSC stands for Recovery Oriented System of Care. Really what it is, it's a coordinated network of community-based services and supports that is really person-centered and builds on someone's strengths and resiliencies, not only of themselves, but of their family, the community around them, using those personal strengths to really achieve overall better health and wellness and quality of life, especially for those that are suffering or at risk of substance use disorder. We kind of look at it as a philosophy, right? So I'm going to use myself as an example. I'm a person in longer term recovery. When it came time to recover, right, I had to go to detox and then I had to go to treatment, and we do all those things that we do when we're trying to recover. However, if recovery was just as simple as being separated from the substances for a couple of months, we would all be okay the minute we got out of there. But that's not the case, right? For me, it sometimes took a couple weeks, sometimes took a couple years, but I wasn't treating the right things. And so I went right back to it. So we have to look at recovery as a continuum, right? A person's life, there's so many things that are affected by their substance use. And then we really have to look at trying to treat in the recovery. For myself as an example, I had housing issues. I had employment issues, couldn't keep a job. I had problems, with social groups. There was all kinds of stuff that I really needed to look at as opposed to only treating the substance use disorder. And that's kind of the general idea of ROSC, which is, hey, look, there's so many amazing services and supports in DuPage County that all handle these individual things. But at the end of the day, we're all kind of pulling for the same thing, right? We're all kind of pulling for overall improved health and wellness, as it's a community issue out here in DuPage County. So let's get together. Let's try and find opportunities to collaborate. Let's try to find opportunities where we can refer to each other. And let's really kind of form that net that keeps people from falling through the gaps, which unfortunately happens all too often. So that's really what the ROSC mission has been for the past year. We have also gotten into some kind of tangible things we've been able to do out in the community. And that's where I want to kind of talk about the RCO here. So an RCO, and you can visit this website. It's at DuPageRCO.org. I'm going to move over to the services. It's a little bit easier for me to explain some things. An RCO is a recovery community organization. So this is mostly created by people who or in personal and or family recovery in response to some unmet needs in the community. Often RCOs exist kind of as a voluntary advocacy and service organization for some time until they kind of expand a little bit. But we're really looking at what are the gaps, right? What are the gaps in some of these services in DuPage County for these folks? Now, some of those we were able to identify through the ROSC, right? So we did some assessments last year. And in fact, we have another assessment coming up in a different form in the next month. But we really tried to say, what are the gaps out here and how can we fill those gaps? So through the RCO, we started saying, well, look, peer support is a huge thing, right? We have gotten so many people, and we're really blessed with this, trained out here in recovery coaching. So last year through the ROSC, we were able to train 40 plus people in recovery coaching. Now, some of those people have gone on to follow the track to get certified. Some haven't. But the point is, there is an appetite for people wanting to learn more about multiple paths to recovery and ways to approach people who might still be living with substance use disorder. So we said, well, why don't we find some coaches who we can kind of get together and deploy into the community in different ways. Peer support, we found over time, is just such a huge help for people who are in early recovery. So coaching services, and this is really important to state, this is non-clinical. So this is not clinical work. And you can kind of see the different areas that as coaches we work on. So there's a curriculum we go off of, but we look at physical wellness, occupational guidance, employment stuff, spiritual growth, things like financial stability. You can kind of see some of the other ones here, but all those other parts of a person's life beyond just the substance use stuff that really needs to be worked on and sometimes gets overlooked when someone gets into recovery. Also, a few things that we're working on with this is stuff that before was kind of being done by some ROSC members. So here at Serenity House and at ROSC, we have great prevention education work that's being done in schools. We go out and do persons with lived experience, share their experience with kids in these schools in DuPage. We also go out and do risk assessments at certain schools and individual and group counseling in some cases. Felicia Maselli, who's been one of my wonderful partners here at ROSC for about the past year, has started up here at Serenity House grief recovery. And we found that there's a big need for that. Grief recovery, again, and this is sometimes the family members of people get overlooked too. So we have a bi-monthly grief group that we do here, and we kind of want to expand that out into the community and start some more of those. Narcan training. Through ROSC, we have been able to do some really cool things with Narcan training. We've been able to go to public libraries. We have a few more of those booked in the next coming months. So we go out and we train the staff. We open it up to the library if they want residents to come, and we supply those places with Narcan. So the Narcan training and some of the harm reduction work will also kind of get moved over to the RCO. And then education series. So I'm going to promote this in a little bit, but one of the things that ROSC has done too is a monthly presentation series. In addition to the monthly ROSC council meetings, we meet once a month to kind of get into a current topic in recovery. And it's an hour long. We have some time to kind of dig into it a little bit deeper. Some of the stuff we've talked about in the past few months was we had a presentation on cannabis, specifically cannabis. We had a presentation on family and how family can be affected and affect people who are in recovery. We've done stigma reduction. So we want to continue to do that type of thing through the RCO as well. In addition to things like advocacy, are we advocating for ourselves as people in recovery in DuPage? And where is that advocacy needed? Where can we be visible in the community, which helps so much with stigma reduction? So as you can see, we got a lot planned. This is still a relatively new thing. And we've got some great people over here that are going to head it up. But do not be surprised if you see some outreach calls from myself and some other people over here to get you guys to come check out our RCO meetings and just the work that we're doing in the community. So that's kind of the, I was a little long-winded there, but that's kind of the difference as it is out here in DuPage between what the ROSC is doing and what the RCO is doing. While I'm here and I'm looking at websites, I wanted to show off a few things for the ROSC. If you go to DuPageROSC.org, which is our website, in the resources page, so this is still relatively new, but we've been working on it. You're going to see this map right here. So this is a Google map that is constantly being updated. I'm just going to go ahead and expand it so it makes it easier to see. But as you can see, this is the Chicagoland area here. And then if you look over here on the left, this is various layers of services that you can find. So substance use disorder, mental health, veterans, emergency housing, you can see all the types of stuff that are listed over here. So if you were someone who was looking for services for yourself or someone else, you could go over and say, okay, well, I'm looking for some substance use disorder services. I'm going to click that. So there you go. You start to see geographically all the different areas that are listed for those particular places. I'm going to pick on us because I'm partial to the place I work. Where are we here? Up in Addison. Okay, so you see these spots. You can click on the individual places, and over to the left will come up the services they provide and a contact number. So we know sometimes that we can search for things, but we wanted to think geographically. Like if someone was saying, transportation is a barrier for me. I live in this certain area. What are the things that are available to me? They can kind of look by that. And then they can also contact the places through there. So this is a Google map. This is constantly updated. It's a living document, as it were. So if anyone is ever looking for something like that, that is on the DuPage ROSC website. Also, I don't show these off too much, but real quick, we have a YouTube page. So if you ever miss any of the meetings, so both the meetings and the presentation series that we do, these are up on our website. So as you can see, we have, about 10 DuPage ROSC Council meetings. And right now, I think there's 2 of our presentation series, but these are uncut. It's just the full meetings. So if you ever miss it, that's where they go. And then lastly, we have a Facebook page. If you just search DuPage ROSC, you can find it. Now, we keep this updated daily, not only with ROSC meetings and trainings, but just stuff that's going on in the community. So anytime I see something that looks like it could be important or interesting or fun, I try to post it. Now, I've been saying this, and this is, by the way, this is the setup you can't see. This is like a electrical fire waiting to happen. But this is not like our page. It is, but it's not. So this is like a community page. So if you're out here in DuPage or Kane or anywhere close and you've got recovery related events that you want to promote, this wall is open. You can go ahead and post whatever you want, and I found from people that it's a great way to discover some of the stuff they might not have known about before. So yes, you can definitely come and post stuff on there. So I'm going to stop sharing this. And I'm going to do one more thing because I've been talking for too long and I want to get to our guests, but I do want to explain one more thing. Let me get my PDFs back up. Okay. So where's Danny? All right. Danny, my co-coordinator, is going to come up. He's going to explain something here. Come on up. So I'm going to give a preface with this real quick. Quite a few of y'all are on our ROSC referral team. So this is the way this came about. Some of us were finding that we needed to kind of find easier ways to refer, not only for clients that we were working with in the professional sense, but you know how it is when you kind of get into this area in this life, you hear from a friend of a friend that somebody needs treatment, or you hear that somebody's looking for a specialized service and maybe you don't know how to find it. We started a group text. And we found over the past few months that it's been like highly successful in finding referrals for people. So again, like I said, not just detox and not just a type of treatment necessarily, but even specialized stuff that maybe we don't know about. So we kind of want to refer to other people. So we've got like 15 or 16 people in that group chat. It's a group text actually. And I don't know if anyone's ever tried to set up a group text across service providers, but if you try to set up a group text with like Android and iPhone, you really get limited as far as some of the things that you do. So we kind of wanted to expand a little bit. And in 2023, we're kind of going to move all that to WhatsApp. There's a lot of benefits for moving it to WhatsApp. So I'm going to let Danny here talk for a little bit about it because he's kind of the one that's heading up the whole process. So Danny, go right ahead.
Thank you, Jared, and hello, everybody. Yeah, so as Jared said, the referral group text and process has been working excellent. This is just a way of making it all more user friendly and easier for us all to connect and better serve the population. So what you kind of see right now in the background, we put together detailed instructions of how to download WhatsApp, what the different screens look like, and how to join our referral page. So if you haven't already, please put your email information in the chat and or just reach out to us via one of our platforms. So that way we can get it out to you guys. We plan to launch on February 1st. And if you're interested, have any questions, like I said, just reach out and we can send you these instructions and or just, walk you through how to do so.
And after the meeting, thanks, Danny. After the meeting, when I usually send a follow-up email, I will include this. This is just a PDF, and it's literally a step-by-step thing. So if you think it would be beneficial for you to join that, please reach out and we'll get you set up. And the important thing is this, and this was important to me when we were setting up the group text. I really don't want to bomb people with texts. I don't want to make them, blow up their phone for stuff. This is a little bit less invasive as far as using this program because there's little sub chats we can create and there's a lot of cool stuff we can do through WhatsApp. So again, send this information out, and then hopefully we can get some more people on that group thing, because I think I counted maybe 20 plus people we've been able to find referrals for in the past few months. And these are people that maybe wouldn't have gone to treatment or didn't know how to get there, or couldn't find their service. So it's been really, really successful for us. So I have spoken enough. I'm going to stop the share here, because I would like to hand things over to our guests. So as I mentioned, Bryan Gooding is going to talk to us about the Illinois Helpline for Opioids and Other Substances. We realized before the meeting, Bryan and I actually met over at the Kenneth Young Center over the summer. And that's kind of where we planted the seed about this service. And as I said, us at ROSC and both here at lead agency Serenity House, we've had the opportunity to use this service, and it is incredibly helpful. It's a very streamlined service. There's a lot to offer by using it. And so I thought it would be a great public service to have Bryan come on and kind of explain it. Bryan is actually the regional implementation manager out of the Public Health Institute in Metro Chicago, and he does some great outreach work. So Bryan, I'm going to go ahead and turn it over to you. You're already the co-host, so if you got a screen share, go right ahead.
All right, great. Thank you, Jarrett. Before I share my screen, I just want to thank Jarrett and Felicia for recognizing the value of this resource, inviting me into the space. And I want to thank you all for choosing to spend some of your time for me today. I'm also a person of lived experience. I'm in long-term recovery, but not abstinent. That's a concept. You know, we want to honor everybody's path to recovery, and it looks different for everybody else. So, but that's a conversation to have another time if you aren't aware of what it means to be in long-term recovery but not abstinent. But I'm here today to talk about the Illinois Helpline for Opioids and Other Substances. Just kind of by show of hands or a thumbs up and reaction, who here on the call has heard of the Helpline for Opioids and Other Substances? All right, so it seems like we've got a few people that have, a few people that haven't, so that's really great. But I'm going to go ahead and share my screen. So we're going to spend a little bit of time today. We're going to talk about the Illinois Helpline for Opioids and Other Substances. We're going to talk about kind of our approach, how we approach our work. We'll talk a little bit about the services that we provide, the components that make up the helpline. We'll do a quick peruse of our website because it's really robust, and there's been a lot of changes and updates lately. And then we'll kind of wrap it up with some next steps and how you can use the helpline in your own work. All right, so that's me. As Jarrett said, I actually work at the Public Health Institute of Metropolitan Chicago, where I'm a project manager. That's a recent promotion for me, so I'm actually managing a couple different projects. And one of the projects that we have is serving as the community outreach and engagement coordinator for the Illinois Helpline and Other Substances. Just a little background for you folks that don't know what the helpline is. It's the only statewide public resource for finding substance use, treatment, recovery, harm reduction, and a whole lot more, as you'll see as we move through this presentation across the state of Illinois. We're 24/7, 365-day-a-year resource. You can connect us, excuse me, you can connect with us in 3 different ways. Through our call center at 833-2-FIND-HELP. Is an easy way to remember that. We have a very interactive and robust website at helplineil.org, which we'll look at a little bit later. And newer, you can text the word HELP to 833-234 to be connected to those same caring, compassionate folks that will help you connect to services. And the helpline is really available for anybody. So whether you're in long-term recovery, short-term recovery, if you're a friend, family, loved one, if you're a case manager, provider, probation officer, faith leader, this can be used for lots of different folks and really connecting folks to the services that they need across the state of Illinois. Calls are always confidential. They're available in Spanish and English. I think we have somebody on our team that speaks Polish and Russian right now, but any other, we like to serve people in their own language. So we use a language line solutions to service those callers that are calling and using other languages. You can be any age to receive information from the helpline. What we are not is we are not a hotline or a crisis line. We are an information resource and referral hub. So folks that are calling that are in a crisis or need those hotline services are directed back to those appropriate resources. So here's my required piece. I have to tell you about our funding stream. I left us out of a presentation once in interest of time, and somebody from Super was there and they clocked me on it afterwards. So we are administered by the Department of Human Services through the Division of Supra and funded through SAMHSA, by SAMHSA through the State Opioid Response Grant. The helpline is actually run by a nonprofit organization, Health Resources in Action. They manage all the clinical work and the resource hub, and they subcontract with PHIMC for that local outreach, education, and support on the ground. So I think first I really want to kind of talk about our approach and how the helpline approaches our work. We use a harm reduction model of meeting folks where they're at in that moment and providing with the resources that they need. And it may not always be a direct, direct substance use information, right? It's what those resources and tools somebody may need to support them in their recovery. We like to think we offer caring, non-judgmental expert services. Our staff all have relevant training and certifications. They're overseen by master's level clinicians. They really reflect the diversity of the callers. We have a very diverse staff. We use motivational interviewing techniques, really letting that client, that person in our care who's calling, guide that conversation so they're getting what they need out of it, not what we think they need. We have a trauma-informed lens. We realize that trauma plays a big role in substance use, and especially over the last 3 years or so with a global pandemic, social unrest, racial reckoning, all that kind of stuff. People have been traumatized, re-traumatized, triggered, found new triggers. So you want to really keep that in mind. And we're also grounded in racial equity, realizing that there are some populations, specifically our Black and Brown and Indigenous brothers and sisters, that are disproportionately affected by substance use. So when I'm doing outreach, not only am I attending ROSC groups, but we're trying to focus information and resources in communities that are most affected by substance use, and specifically the opioid epidemic. We listen without judgment. That's a really big thing, right? We know there's a lot of stigma, shame, misinformation that comes around, comes with substance use disorder. So we really want to bust through that, right? And be a safe place for folks to be able to express what they need in that moment. We can provide support, keeping the process simple, as Jarrett expressed. We try to streamline that process and make it as simple as possible, because we know the more difficult that process is, the less likely somebody is to engage in those resources, information, or referrals. We help provide options and next steps. We also provide follow-up service and warm handoffs. So can we connect you to that service right now? Can we have somebody follow up with you in a day or so to make sure that you've actually accessed those resources or referrals? And if not, what are those barriers? What are those next steps? How can we facilitate you in moving forward? And most of all, we like to think we instill hope in folks that are calling the helpline. That recovery is possible, and we want to support you wherever you are on that journey. Because as Jarrett expressed earlier and I expressed, recovery, it isn't a solo journey, right? We need help and support, and it looks different from everybody. My experience with recovery is different than Jarrett's experience with recovery is different from the next person's. So some of the services that we offer, again, we're assessing consumer needs through conversational actions, conversational interaction, building that rapport with that person. We're sharing referrals to treatment, recovery, harm reduction, and a lot more. We're providing that education and support, right? What does harm reduction look like? What does recovery look like? What does treatment look like? And we're offering strategies for navigating the continuum of care, because that can be difficult also. I mean, it is a sad reality that healthcare in this country is really convoluted. You're going to get different levels of care depending on who you are, where you are, what type of insurance you have. So if you're uninsured, you have Medicaid, you have Medicare, you have private insurance, you're going to get different levels. Unfortunately, you're going to get different levels of care based on those factors, right? So really offering those strategies for navigating the continuum of care and knowing having a handle on the spectrum of services in Illinois is a really important piece of what we do. We can filter results by substance use, location, age, health insurance, dual diagnosis, gender-specific programs, family services, unhoused folks, veterans, pregnant and parenting, et cetera. So we really can filter our results by a myriad of options. Here is just a very short list of some of the services that we can provide folks or refer folks to. I always put harm reduction services at the top because that's where my heart is, and I believe that's how we address this epidemic and substance use, is really meeting people where they're at, treating them with dignity, respect, and providing with the services that they need, right? I can come up with a perfect plan of how I think Jarrett should proceed in his recovery, but that's probably not going to be right for Jarrett. So let's find out what Jarrett wants or needs in that conversation, right? So a little bit about helpline components. What makes up the helpline? So really, the core of the helpline is our screening and information specialists. Those are the folks that answer the phones or reply to text or chat. They can be reached by phone, text, or online 24/7, and they're really the backbone of the helpline. We have a state-of-the-art infrastructure, which includes a database, website, telephone call center system, and a call center. Again, we can be reached 24/7, 365, and we have some really engaging online features, which we'll look at here in a few minutes, including a self-assessment tool. The provider portal is a really important piece of our website. That's where providers can go in and manage, add and/or manage or update their program information within our system. Folks that are funded under super for doing substance use prevention work are actually required in their contracts somewhere to engage with the helpline through our portal to make sure that we have the most up-to-date and accurate information when folks call. I've been in have spent many years in direct services, so I know what it's like to come up with that resource guide and think about giving people resources, right? And if I give you a resource and you call and they don't answer the phone, or if it's a different person, it's a wrong number, then all of a sudden I'm the guy that gave you the bad resource, right? So I think about, and you're going to tell everybody about it. So I think about that a lot when I'm doing outreach for the helpline and highlighting the provider portal, is making sure that we are a valuable, up-to-date resource. We want to be that trusted resource. So some of the other ways that we connect folks and entry points into the helpline is through our capacity management system. We call it our CapMan. It was launched in July of 2019, and it's a centralized, confidential, and secure integrated system that residential treatment service providers can use in real time to manage bed availability, and or their programs wait lists for services. The helpline uses this information to really streamline and facilitate access to available services for Illinois residents. So this is another reason why it's important for folks to go in and engage with us through our provider portal and updating their information on a regular basis. So we can refer folks to services in their own communities or as close to as possible. Another kind of access point excuse me, for the helpline is a newer relationship with a PMP, prescription monitoring program. If you don't know what that is, it's a database where providers use to when they're prescribing new opioid medications to make sure that folks aren't double prescribed and all that kind of stuff. So they're really monitoring how opioids are being prescribed out in the community. So with minimal interaction from the provider, there's a button they can push in the PMP system that will send patient information with their consent, of course, prompting a call back from one of our helpline specialists. So, and these people have been self-identified as needing some substance use treatment or referral information, or it can be as simple as just getting a little bit more information on opioids themselves, right? When you're being prescribed a new opioid, you should be leaving there armed with the information, knowing what it means to be prescribed an opioid, right? And the potential addictive qualities. You should definitely be leaving there with overdose education and naloxone, right? I heard a lot of conversation going on before this about this is where you can get Narcan, right? It's a really great system. So we can simply be that person, right? Connecting those folks with a new prescription to overdose education and Narcan distribution. So we also serve as a central access point for DHS services and benefits and other services. In March of 2020, kind of as a response to COVID, IDHS came back and asked us if we would add some more information or resources to our phone tree. So when you call now, you can be connected to those IDHS services. We have such as Medicaid, SNAP, cash assistance. We have some housing resources, some connection to the Illinois Warm Line for behavioral health services. If you want to talk to somebody right in the moment, right? Assistance with everyday living. There's a button for getting state updates around public health initiatives. So it's really about supporting the person as a whole. We all, I come from a social work background. I don't know if you folks have are aware or know of the Maslow's hierarchy of needs, right? That pyramid where everybody wants to be at the top of the pyramid, right? And full recovery and all that kind of stuff. But it's those layers underneath, right? What are we doing to support you to get to the top of the pyramid? What do we have to have in place in order to make it work for you? So that's what that's kind of all about. We have also have some support for clinicians looking to or currently prescribing medications for assisting recovery. That's MAT, MAR, MAOUD, whatever you're calling it in your circle. But that really is the strategy of providing medications to assist somebody or in their recovery and maintaining their recovery. So from a dedicated landing page on our website, you can find professionally developed MAR toolkits, a curated resource library, and some up-to-date learning events calendar. So that's really important. We want to increase access to MAR across the state of Illinois. And we'll talk about that in a couple of slides because there's a really great program in Illinois going on right now. If you don't know aware of, that's called MAR Now, but we'll talk about that shortly. This is our website. I don't want to spend too much time here, but if the technology gods will cooperate. Come on. I thought they would. We'll try one more time.
Bryan, listen, I've been trying to do this meeting hybrid for a year. Like, I'm telling you, man, the technology is still the hardest part of it.
Okay. Well, I'm just gonna do it this way. All right. So here is our website. You see there's some big buttons across here: call, text, chat. You can switch to Spanish up here in the corner. I'm going to kind of focus on these buttons right up here. So the first one is get help, and it's exactly what it sounds like. Just a caveat right now, the gambler, 1-800-GAMBLER, that line, that work has moved underneath the helpline. So that's now integrated into the helpline. So there's some resources on gambling there. Pregnant and postpartum women. There's in the state of Illinois right now, the #1 cause of death for pregnant and postpartum women is overdose, and 97% of that is opioid related. So that's an at-risk population. So we want to make sure that we're focusing on those populations with our intervention strategies, specifically MAR, to make sure folks that are aware, and we're not losing those women to overdose. There's some general information. What does recovery look like? What does harm reduction? What's treatment look like? And links to those services. Here's where you can do, which may be helpful for you in your work, is where you can do an assessment. You can do a self-assessment or do one for your partner or your person in your care. And as you move through this, you'll see that the attributes change, and at the end you'll get a list of resources based on the answers to your questions, and hopefully close to you or in your community. This is I love this page. I'll spend a few minutes brief time here. This is really, I think this is my stigma buster page. This is what we wanted, how we can help someone, and steps to take and actions to avoid. And these can be really a great resource, because we can have, especially if we're dealing with somebody that's actively using or experiencing substance use disorder in our own life, right? That's personal. We can have some knee-jerk reactions to that. So this can be a really great a guide to help you through that process. Some of the steps you can take: understanding that substance use disorder is a chronic disease that requires treatment, support, and new coping skills, right? And then down here, maintaining hope, supporting recovery as a process. And then most importantly, finding your own support network, right? Family and friends need encouragement and support too when trying to deal with substance use in their own life. This is the banger right here, is the actions to avoid. Our goal is to support somebody wherever they are in that process. We want to get them into recovery. We don't want to drive them away, right? So some of these things can be really stigmatizing. So don't expect your loved one to stop using when you want them to or without help, right? That ultimatums, right? Don't give them ultimatums. Don't lecture, threaten, or make bribes. Don't appeal to their emotions, right? Because again, the goal is to get them into recovery. We don't want to alienate them or drive them away. So we want to be strength-based. And on the other hand, don't cover up or lie. Don't assume responsibilities, right? That whole enabling part. We can be helpful to somebody without enabling their behavior. And most importantly, don't argue with somebody or try to reason with somebody when they're under the influence, right? And here you'll find access to support groups. So one of the kind of benefits, if there is any, to COVID was the proliferation of online support, especially for folks that are affected by substance use. You can call the helpline anytime. And then most importantly, learning how to manage overdose and access to naloxone. I think as Jarrett does, that any human being that has access has contact with another human being should be carrying Narcan at this point. If you have somebody in your family that's experiencing substance use disorder, you should have Narcan on hand. I know in my holiday family gathering, we have some people that we know that are experiencing substance use disorder. So I made sure that there was Narcan available at our family gathering, right? To in case anything happened. So this is really important. The Stay Safe is our harm reduction page. And this is where kudos to all you harm reduction providers out there. That's where my heart is. You know, with over 100,000 folks dead in a 12-month period and more than 3,000 of those folks here in the state of Illinois, to me, we are in save people's lives mode, right? There is no recovery from dead. There's that. So we need to get people there. And to me, that means access to clean syringes through syringe service programs. That's definitely that Narcan education and naloxone distribution. That's resources like Never Use Alone, right? And providing folks those kind of resources. It's also about testing, access to fentanyl testing strips, right? Or because just like there's been an interruption in the global drug supply chain, there is an interruption in our global drug supply chain. And we don't know what's in those drugs. And there's poly substance use. Fentanyl is being found in everything from marijuana to cocaine to heroin. They're pressing it into pills that look like Norco, all sorts of stuff like that. So knowing what your drug, what's in your drugs is a really important place, and providing those strategies on how to manage your drug use, right? Some people are just going to choose to use drugs. That certainly does not mean they deserve to die from that choice. So we need to be providing them with intervention strategies, resources in order for them to use safely. Down here, you'll find, oh no, that's on one of the other pages, but there's some stories from some of our harm reduction providers there.
Hey, Bryan, we got a couple minutes left for the presentation.
Yeah, well, let's move right to the MAR now piece then, okay?
Perfect.
We can do that. So there's lots of different resources here. So there's just a little bit of data around the calls to the opioid to this. This is some data from Cook and Cowell County, specifically on our top primary substance activity, top treatment referrals. This is kind of who's calling us and the breakdown. But I think the most important piece to talk about in this presentation is the MAR Now program. And that's a new program launched in May, but it's gone statewide. And what it really is callers is providing support for people that are wanting to access MAR Now. We know that recently the White House eliminated the X waiver. That's that waiver, that the hoops that people used to have to jump through to prescribe buprenorphine, and that's gone away. So we're really hoping to increase access to these services around the state of Illinois. And there's a lot of stigma that actually goes with MAR Now. So right now, and MAR Now is right now, in that moment, connecting that folks to that service, right? They're ready right now. They weren't ready yesterday. Who knows where they're going to be tomorrow? Let's fill those gaps. So callers to the helpline can request MAR Now or request any form of immediate treatment for opioid use disorder, and they'll be connected to an MAR care manager for immediate access to medication and counseling services, including that telephonic prescription induction prescription and home induction onto buprenorphine. So it's available to anybody across the state of Illinois, regardless of your ability to pay, your insurance status, your documentation, and care managers can also help with transportation. So we will provide you an Uber, a bus pass, a taxi to the pharmacy to pick up your first prescription. We'll help you get to your first appointment with your provider. And it's available 7 days a week, 24/7. It's also really great for folks that in a hospital setting who are diagnosed with opioid use disorder. We also often know that's kind of a drop point for folks. They're showing up, they're presenting with overdose or opioid use disorder in a hospital, but they're not leaving there with the resources or information that they need. So folks diagnosed with opioid use disorder can access MAR now right in the hospital, and referral information to outpatient care that support their long-term recovery. So we can help that hospital staff do that induction right there in the emergency room. So for patients appropriate for buprenorphine, we'll do that right there. If they're requesting some other form of like naloxone, or methadone, we can also arrange a definitive treatment for that. But I think this program is a real game changer in the state of Illinois in connecting folks to these services. I've had a lot of success stories, specifically in some of our rural or more isolated communities where they have had trouble getting people into services, and they've been able to call the helpline, and within sometimes within an hour, they've had a medication called into a pharmacy. So I really wanted to take the time to highlight that program today. And just really quickly, how you can help promote the helpline, facilitate referrals, treatment services, use and encourage others to use that provider portal, making sure that your information is up to date, provide feedback on your experience. We like to hear that. And then use the helpline to for your client referrals and loved ones. And you can promote us on a helpline on social media, and contact us with any other, or myself with any other opportunities. I do a fuller presentation. I've been to church groups, support groups, provider organizations. So I'm willing to come out to your organization to do that. One other thing I wanted to just add to the conversation about accessing Narcan is that there is a state program called Access Narcan, where you can register as a DOP yourself. So I've helped some faith groups, some church. I've had churches that have registered for as a DOP. So I've had outreach groups such as Sex Workers Outreach Project in Chicago. We helped register them as a DOP. So you can have access to Narcan within your own organization. So I will send out a copy of these slides to Jarrett along with a fact sheet about MAR Now, and then I'll send a flyer about Access Narcan Now too. So if your organization is interested in becoming a drug overdose prevention provider, you can order Narcan directly from the manufacturer for free, and we all know it ain't cheap. So that's a really great program.
Bryan, thank you so much for taking the time to present all that for us. I do want to leave here like a minute. Does anybody have any questions for Bryan? He put his contact info up there, and I'm sure he'd be happy to answer any questions that way. I think Bruce, you had asked about specific medications that were in the MAR Now program. I think Bryan may have touched on that a little bit as far as naloxone, Suboxone, methadone. Was there anything else you were curious about?
Well, you know what is, I know there's a distinction when I was running the SHARE program of MAT versus MAR, and the director of SHARE said that MAT was more method. When people say MAT, people thought methadone, and when it was MAR, it was not. But is MAR now more all encompassing, or?
Yeah, I think they're interchangeable at this point, whatever you're calling it in their sphere. Specifically for the MAR Now program, the immediate access is to that buprenorphine, because any provider technically can prescribe buprenorphine or Suboxone to their patients. So that access is a lot easier, right? And we're really promoting that because it's more accessible than, say, that methadone or naltrexone, where there tend to be a lot of rules and regulations just around participating in those programs, right? Which can be a barrier for some people and discourage them from from engaging in treatment, whether they're can only access it during certain hours, right? You may have counseling requirements that go along. You may have drug drops that go along with that, right? We need to start measuring success by people's actions, not by the content of their urine. So that buprenorphine is really the way to go, I think.
Yeah, that's a great mantra.
Yeah, yeah,
What
you
you
know,
just said
because
about the
success
content of
is
their
measured in
urine.
many different ways, and
Yeah.
it definitely isn't the content of your urine.
You
Well
should
said.
trademark that and put it on a t-shirt.
Oh, yes.
All right. Well, I want to thank you again, Bryan. And like I said, his contact info is up here on the screen. So if anybody wants to reach out to him, but if this sounds like something that could be helpful for you, or if you're at an organization where you're looking for something like this, please use it. It's incredibly helpful. And yeah, so Bryan, thanks again for coming, man. We really, really appreciate it.
Thank you all. I appreciate you too, and I'll send the slides out to you.
All right, perfect. So we got about 5 minutes left. So at this time is usually when I throw it open to the community here. If there is any kind of programs or events or needs that you have in your area as it pertains to recovery, that we as a group might be able to help with. So I'm gonna open it up here. Has anybody got anything to announce? And I say this all the time, not all at once. Hold on, I got somebody here. I get to use my second mic. This is awesome. You guys can't see it. There's a whole room of people right now. All right, go ahead. This is John from CDH Hospital.
Hi. Yes, exactly. John from Central DuPage Hospital. I just wanted to let everybody know that we have started an adolescent co-occurring program. It's a mid-afternoon and then a later afternoon for PHP and IOP. So it's the first for us to have something that's offering mental health support and substance abuse support for struggling teens. And I can get more information to Jared on that directly. And then the other piece is over at our Winfield location on the Central DuPage Hospital campus, where we have our adult addictions programming. We have also opened up an evening IOP program as well. And the benefit, at least that's very nice about it being outpatient minimally, is it avoids a lot of insurance restrictions. Medicare would pretty much be almost the only insurance we wouldn't be able to take for anything outpatient. But all the other traditional Medicaids and things like that are all open for pieces. So just wanted to pass those along that we have them, and I can get the info to Jared for those who might be interested or just have people to refer, just more questions. Thanks.
Excellent. Thanks, John. Anybody else got anything they want to promote? Because if they don't, I've got some. I've always got some. I see in the chat here, Lisa Bloom at NM Behavioral Health mentioned that there's a new adolescent co-occurring program starting this week in Wheaton, MH, mental health and substance use. So her email is in the chat if anyone's interested in scheduling a tour. And if you'll allow me, I need to share the screen once more. All right, a few things to promote on our end, right? So the ROSC subcommittee is back. We took a month off in December for the holidays, but we have some really, really big projects that the ROSC are working on that I cannot announce yet. However, some of the details of those projects will be hammered out at this subcommittee meeting. So we try to do this one in person only, just because there really is a lot of conversation that's needed. And I kind of like seeing people face to face after doing a hybrid. So if you're available Wednesday, January 25th at 7 p.m. here at Serenity House, we meet. We got a great group that usually meets once a month. Come see us, 7 p.m. So we do that monthly. That's the last Wednesday of every month. Next week, our ROSC presentation series is back. So as I said earlier in the meeting, this is something we do separately from this ROSC meeting, that we kind of have some time to kind of dig deeper into some of the topics and have a little bit more time to spread out and talk about it. So we're actually doing domestic violence next week. DV, forms of abuse, how to recognize signs, and really how this might intersect with substance use disorder. So Zoe, who's a ROSC member, but she's also in our women's program at Serenity House, will be talking. In addition, we have Stephanie from Breaking Free, Mutual Ground in Aurora, who'll be talking about their services. So that's at 10 a.m. On the 18th. So please come and join us for that. We always have a great group that comes out for that. And all this stuff I'll follow up in an email too. And then lastly, I mentioned the sock drive. So, well, I didn't know if I mentioned socks, but I mentioned the clothing drive. So we did winter coats last time. Coming up in January, we're going to be doing a sock drive. Now, socks are something that I think we definitely take for granted. As somebody who's formerly unhoused, I can honestly say that like a fresh pair of socks is literally like a godsend to get. And when we talked to People's Resource Center and dropped off the coats, they had mentioned specifically that socks were always something that they were looking for. So we're going to be collecting socks for about the next month. You can drop them off here at Serenity House. If you come by for a meeting, like maybe for the next ROSC meeting or the council or the committee meeting, you can drop some off. I should say new and unworn socks. I appreciate all the donations, but I just say new and unworn socks. And we will hopefully in the middle of February have enough to go drop off at the People's Resource Center in Wheaton. So thank you again to everybody who donated for the coats and will donate for the socks, which we've already gotten some. I do also real quickly with the last minute here, promote the next 2 ROSC meetings. So the next ROSC council meeting is on Wednesday, February 8th. Like I said, it's always the second Wednesday. So coming up, there's going to be some really, really important new bills and laws that are being worked on in relation to substance use. And we have got some folks to come and explain kind of what those are and how we can advocate for them. This is very timely and this is very important stuff. So I'd really like everyone to make it to the next one. And then in March, we're really excited because Rebecca and Gabby from Naomi's house are going to come and do a presentation on trafficking, human trafficking, which is a very, very underserved area and kind of intersection with substance use and mental health. So we're excited for them to come out. Other than that, thank you again to everybody who attended. Be on the lookout for a follow-up email with all of these resources and everything. And thank you again to Bryan for presenting for us today. I'm going to hang on for just a minute if anybody needs anything. Other than that, have a wonderful afternoon.